Hi, Dr. Byer. Today we're going to talk about reason number 5 why you have digestive problems and no one's finding out why. Okay, big complaint that I hear from people, they got bloating, indigestion, they're fatigued all the time, they got colitis, diverticulitis, get acid reflux, GERD, you name it, ulcers, and pancreatitis and gallbladder problems, and they go to their gastroenterologist and they don't really get any answers. This is a very common one that I see in my clinic. Folks, your stomach should be very acidic, okay? And the reason why the stomach, we talked about this on prior videos, but when the stomach has proper acidity, food will empty from the stomach quicker, in a quick fashion, which it needs to, and it goes into the small intestine. Now, in order to absorb your fat and your fat-soluble vitamins, vitamin A, D, E, and K, you need bile. Bile is made in the liver and then it's stored in the gallbladder. You need to be able to store bile because the liver cannot make enough bile for one fatty meal or one dose of fat-soluble vitamins, okay? So the liver makes bile and it stores it in the gallbladder for when you need it. When the food comes out of the stomach, if it is acidic enough, it'll trigger the gallbladder to release the bile if you have any fat or any fat-soluble vitamins in what you just ate. So you will not absorb these things, folks, and we see a lot of vitamin D deficiencies, poor skin, poor immune system function, poor hair, all of this, and low energy when the gallbladder doesn't work. If the food coming out of the stomach is not acidic enough, the gallbladder will not be stimulated, and the bile will sit in there. It forms gallstones and things like that, and you know the medical solution to that is to pull the gallbladder out. That's not such a good idea because now you've got a lifetime of deficiency in fat and fat-soluble vitamins. The other reason is bile is also very important for the removal of toxins from the body. One of the ways our body removes toxins is through the liver. And the liver takes it and it attaches bile to it so that the toxins can go out in your feces. One of the things that gets eliminated this way, very important, are your hormones. If you don't have a gallbladder or do something to replace your bile, or if you have a dysfunctioning gallbladder due to what we talked about, you're going to develop hormone imbalances and toxins are going to build up in your body. So I don't care what they tell you, your gallbladder is necessary. You need a healthy gallbladder to be healthy. If you've had your gallbladder removed, there are things that can be done to go around this. I'm Dr. Byer. Hope that makes sense. Talk to you next week.